My name is Professor Peter Mungai, the director of the East Africa Kidney Institute. I am a urologist and trained both in Kenya and the United Kingdom. My specialties are prostate cancer and reconstruction. I've been working as a urologist in the Department of Surgery for the last 30 years. I've also been the director of the Institute for the last 11 years. I have been to various places. In relation to training, I've been training both postgraduates and undergraduates for the last 30 years. The East Africa Kidney Institute is an institute of both the University of Nairobi and the East African community. It is one of the centers of excellence under the East African community domiciled in Kenya. It is supposed to provide training, service, and research for urology and nephrology in Kenya and in the region. It is an institute that has been there now for the last 11 years at the Kenyatta National Hospital, and we now have a new institute building with 250 beds coming up to be ready in the next 30 days. The institute has various general urological procedures like prostate surgery, both benign and prostate cancer. It also has stone surgery, both ureteroscopy and percutaneous nephrolethotomy, as well as open surgery and laparoscopic surgery for stones. The institute also does kidney transplantation, doing a kidney transplant every week, expected to increase to a transplant every day by the end of the year 2022. The institute also does various other procedures like oncology. We have a brachytherapy for prostate cancer, and we do radical prostatectomies, cystectomies, and such other procedures. So it is a true center of excellence. The institute has 3 operating theaters on a daily basis, and so we are able to do close to 60 patients every month for general work, and about another 40 for emergency work at the institute. We have 40 senior house officers and senior registrars working at the institute, most of them from Kenya, but from the region as well. The institute offers training in various things. It offers training in urology and nephrology, both for doctors, for surgeons, and for nephrologists. Now, the institute has, as far as urology is concerned, training for those who come straight as undergraduates who would train for a period of 5 years to become certifiable urologists, board certifiable urologists. But those who have done general surgery elsewhere would also come and do 2 years of training to also become board certified urologists. So we have 2 entry levels after the undergraduate and at the after the Masters of Surgery level. A fellow at the institute would be expected to have learned how to do various things at the end of it, like kidney transplant, should be conversant with transurethral resection of the prostate and other urology procedures, and should have been introduced to more complex treatments like percutaneous nephrolithotomy and radical prostatectomy and radical cystoprostatectomies. The trainee coming to our institute, like I said, can have 2 entry levels. You can enter as an undergraduate to train for 5 years, or you can enter as a surgeon to train for 2 years. In both cases, it is expected that the surgeon coming to train at the institute would be one who is registrable as a doctor for those coming in as a graduate students, and for those having trained in surgery, they would be expected to be registrable as surgeons at the board in the Kenya and the East African community. A trainee working at the institute would have been exposed to a variety of patients, both in oncology, in stonework and transplantation, that the student should have learned enough to take the same skills home and improve on them when he goes home. But he should have been introduced to all these skills by the time he finishes his training at the institute. A logbook would be signed to show what the student has done, some procedures the student would be expected to have done by himself, others he would have been expected, if they are more complicated, to have just done as an assistant, and others he could even have been the surgeon and was assisted by an expert surgeon.